Hello everyone, welcome to another Power Talk with Archana. Power Talk with Archana brings to you Power Health in collaboration with Fortis Healthcare. Over the past 4 days, you have heard the specialists from Fortis Healthcare talk about the health of your heart, your eye care, the importance of your lungs, and lots more. Today, in this series of Power Health in collaboration with Fortis Healthcare, we will be talking about the myths about your mental health. Dr. Gargi Vishnoi. Dr. Gargi Vishnoi is the counseling psychologist with Escorts Fortis Healthcare in Jaipur, Rajasthan, India. And she has been working with 32 districts in Rajasthan for stress management and mental health. Let's give a very warm welcome to Dr. Gargi Vishnoi. Good afternoon, doctor. How are you doing?
Good afternoon, Archana. I'm very well, thank you.
Thank you, doctor. Thanks a lot for speaking to our audience. My audience would like to know about 5 tips from you to help them manage anxiety.
So basically, anxiety is an individual feeling a bit nervous, tensed, and there is a general physiological feeling of hyperventilation and palpitations. So the first thing that somebody can do to manage anxiety is basically controlling their breathing. So this excellent exercise of 4-7-8 breathing, wherein 4 seconds you inhale, for 7 seconds you hold your breath, and in 8 seconds you exhale. What happens is that it reduces your heart rate, it brings down your tensed breathing, it also brings down any sort of anxious thought that you're having. So this is the first thing. The second thing is creative visualization. Creative visualization is basically wherein you just close your eyes whenever you're feeling anxious. Close your eyes and imagine a happy place. Whenever was the last time you felt really happy, you were joyous, you were excited, exuberant. So when you go back to a place like that, or it is a place in future or where you're planning to go, planning to travel, so what happens is that you take away your attention from something that is really kind of freaking you out, and then you put it actually into something that's pleasant for you. So your anxiety symptoms, they go down. Then the third one is that you move your body. See, what happens is that we're trying to take away your blood flow from overthinking to your limbs, right? So when you start moving a bit, when you start stretching, or maybe do some quick cardio, or even if you're doing some yoga stretches, what happens is that your blood flow grows in your limbs. And that is when your anxiety goes down, your anxious thoughts, they kind of become limited, and I think any sort of kinesthetic bodily movement is very good for you to reduce your anxious thoughts and anxiety. Then one excellent technique is actually categorizing your thoughts into thoughts in your control and not in your control, right? So probably there's some sort of thought that's going on in your head that, oh my God, what's going to happen in my exam? For students. So you can ask yourself, so what is in my control? In my control is that I remain calm and collected, and I kind of revise well. What is not in my control is how the examiner gives me marks, or what are the present circumstances of the exam. That's not in my control. So when you categorize your thoughts into in your control and out of your control, automatically your brain kind of calms you down into not thinking too much about any anxiety-provoking situation. And then lastly, but the most important technique to manage anxiety is grounding. Grounding is basically when just whenever you're feeling anxious, close your eyes, remove yourself physically from that area. For example, if you're feeling anxious in your office, get up from your seat and move to a different space. Close your eyes and just try to identify 5 sounds that are around you. Any 5 sounds. It could be AC, TV, fan, people talking, whatever. And you name them. Then moving on, try to identify 5 smells. Name them, open your eyes, look at 5 things and name them: glass, table, chair, and then touch 5 things and name them. So what this does is, it brings away your attention from your anxiety-provoking thought, and it puts it into your sensory organs. So these are 5 things that you can take into manage anxiety.
Lovely. I think these are really beautiful pointers that you have given to the audience today, and they can really make use of these. Doctor, tell us one thing. We have been hearing a lot about obsessive compulsive disorder, the OCD. What are the 5 myths regarding OCD that you would want people to know about?
So OCD as a word is being thrown around a lot, and it's being used very callously and casually around us.
Yes.
So it's important for us to know that what OCD is not and what are the myths regarding OCD. So number one is that anyone who likes to keep things clean and organized does not have OCD, right? It is an actual disorder. It is an actual up and down of your neurotransmitters, your serotonin, your dopamine and GABA. So it is not just somebody who is just a clean freak, like you would say. So it's not simply that, it's much more, right? Then there is also very important myth that once you understand that your actions are irrational or your thoughts are irrational, you stop with your compulsions. It's not in your control. For example, if you try to tell someone your hands are clean, why are you obsessing over it and why are you washing them? So no matter of your convincing or them understanding that their hands are clean will make them stop. They cannot willfully stop, right? And then moving on, there are people who might think that, okay, you have OCD, so you are nitpicking and you are somebody, by nature, it's your personality. OCD is an illness. OCD personality type is completely different, but OCD as an illness is completely different. So these are two things which cannot be combined. And the last myth is that OCD will never get better. So OCD does get better if you take proper medication and take proper therapy. So you can totally overcome the disease.
Great. I've also noticed, because of these factors, a lot of cases of depression has come in the forefront. What are those 5 myths about depression, and how do you think this can be really managed well in today's unprecedented times?
Alright, so number one, everybody has to know that depression is not a choice. It is not. It is again an imbalance in your neurotransmitters. Nobody decides, okay, today I will have depression. So this is number one. Number two is that it is not just a temporary sadness. People should stop throwing this word around, saying that today I'm feeling depressed because I woke up sad. It's not that. It's an illness which goes up to a certain level of time that has to be diagnosed properly, right? So it is not that you're just feeling temporarily sad, so you're calling yourself depressed. That's not the case. Then it's not always related to a cause. Depression does not always have to have a trigger or a reason. It can have a reason, but does not always have to have a reason. You can find people who have perfect lives, great family, great job, money is not an issue, everything is perfect, but still they are diagnosed with depression. So it explains that. It has nothing to do with your present life circumstances completely. And lastly, most importantly, depressed is not an adjective. We should not use the word as so casually. It's not an adjective, it is a full-fledged illness. And because you just simply somebody who has diabetes, you can't tell them that, okay, stop being insulin sensitive. You can't stop just start telling them this. And just like you can't tell people with depression that start being happy. You don't tell anyone with a fever, okay, start being cool and you'll be fine. No, you can't do that. So you cannot say that to somebody with depression.
Right. Thank you so much, doctor. Thanks a lot for coming on board and speaking to us. Thank you so much.
Thank you for having me. It was lovely talking.